First of all, thanks so much to APHR for convening this. I think it's extremely timely to have this discussion as the region faces its response in various countries to COVID-19. We know that these measures that are being taken by the government, and of course the risk itself of the virus, is having a very serious effect on populations of concern, namely the undocumented populations, indigenous populations, migrant populations, refugee populations, and stateless populations. I think this is something that we can say generally, we can see across the region. And so specifically, I'm going to be talking about refugees, but I think a lot of what I'm going to say is actually quite relevant to some of these other groups of concern as well. I'd like to also say that besides the roles that I play with the Geutanyoe Foundation as well as APRRN, we also have recently formed in Malaysia an all-party parliamentary group on refugees. And unfortunately, of course, because our parliament has been delayed, it hasn't been that active yet, but it is a group which is made up of members of parliament from various parties, and we are, it's actually still open to membership as well. So YV, if you would be interested in joining it, please do join. And Geutanyoe has been appointed to be the secretariat of that group. So we are, trying to work with the MPs who've signed up so far, and MPs who will sign up in the future to try to keep abreast of developments on refugees in Malaysia and try to push for policy reform. So maybe just to start with a little snapshot, which we can all use as a reference through this discussion. It's just to basically give a quick reminder of the figures that we see in the region of the people of concern that we're talking about, with refugees and asylum seekers mainly, but we also have some figures of some of the stateless population in the region. We didn't put it down for Malaysia, for example, but there's a very large stateless population also in Malaysia, about at least 60,000 in Sabah and at least 10,000 or so in the peninsula. On top of that, 178,000, more than 178,000 registered refugees in Malaysia, and many more who are as of yet unregistered. Thailand has the largest number for now. It's a very large number, almost 500,000 along the Thai-Myanmar border, 5,000 or so open refugees. And there are many people of concern across the region. And in fact, some of these, I think it's important to understand the regional dynamics of some of these populations, because there's a dynamic of, the route that refugees use and irregular migrants use to travel to the region. It also goes across some of these countries. So for example, just for one population of the Rohingya, many of them who do come across from Myanmar directly or even from Bangladesh would use the route via the Bay of Bengal and the Andaman Sea, and would then first try to enter through Thailand, through southern Thailand, sometimes get caught, but sometimes not, and then try to cross into Malaysia via land. Or they would try to disembark directly in northern Malaysia. So Kedah, we've just seen a new arrival, for example, of 202 Rohingya refugees, literally just 2 days ago in Langkawi. And there are, there's concerns that there are more boats at sea currently as well. So this is an ongoing dynamic that affects many countries in the region. We also heard that Indonesia is concerned, and they're looking in their waters also for any boats that might be currently in distress, which are carrying Rohingya. Indonesia has a smaller number compared to Thailand and Malaysia. However, Indonesia's population is also of a lot of concern, because to some extent there are fewer rights in many aspects for refugees and asylum seekers in Indonesia. Although Indonesia has taken a step forward to sign, to have a presidential regulation on disembarkation, at least on disembarkation. It doesn't really protect a larger you know, a larger set of rights for these people, but at least when it comes to disembarkation, there is a set of SOPs and protocols that the government now uses to coordinate their agencies and to allow access by UNHCR quite quickly to their populations. So that's about 13,000 plus, and the majority of that population is actually Afghan. It's not from Myanmar, whereas from in Thailand and Malaysia, the largest proportions of the population are from Myanmar. In Philippines is one of the two countries that has signed the convention in the region. The other one is Cambodia. So it's a very different situation. You know, there you actually have refugees who have either been resettled into the Philippines or have arrived in the Philippines and applied for asylum. And under the Ministry of Justice, you have a process of actually being able to apply and gain protection from the state. It's a small number, but there is access to quite a number of services. But of course, there are still concerns. You know, there are, we actually went with APHR to the Philippines a couple of years back and had a good conversation with the House of Representatives there and the Human Rights Committee of the House of Representatives. And there's still a lot to be done, but we are pleased at least that the Philippines is the strongest country in the region for, in terms of signatories. Cambodia has also signed the convention. It has a much smaller number of official, you know, officially recognized refugees, but at least there is that commitment to upholding the convention. Myanmar is the largest source of refugees in the region and also has an extremely large internally displaced population, and also a very large stateless population. I mean, as we know, the Rohingya are probably the most well-known stateless population from Myanmar, but they're not the only ones either. There are also other populations who are either stateless and many more who are at risk of statelessness in Myanmar. And there are many, many ethnic groups, not just the Rohingya, who in fact are forced to flee because of situations of conflict. And that's been going on for an extremely long time, you know, more than 5 decades, actually, some of these conflicts. And some of them are intensifying. So for example, the Rakhine state itself, where the Rohingya are from, but the majority there is the Rakhine Buddhist population. They are now facing a very intensive conflict, which is escalating at very, you know, with a lot of severity. And there are high numbers of casualties as well as internally displaced people, and many people who in fact are continue to be cut off from humanitarian assistance. In terms of Brunei, Laos, and Vietnam, there's actually very little information. We didn't really have much information from UNHCR, but we do know also that there are certain groups certainly from Vietnam and from Laos also, who have sought refuge in other countries and neighboring countries as well, particularly minorities. Okay, we can go to the next slide. So now to move to the context of COVID-19. I mean, I think, you know, generally we're looking also at, you know, these are populations who face many challenges even in normal times. Many of them don't have formal documentation in their countries, in their host countries. So this is actually having a huge impact on them in the current situation with movement controls, lockdowns, you know, the need to actually get massive screening in many of these areas, and the loss of livelihood. So we put at the top of the list, actually, one of the major concerns currently being the lack of livelihoods, the loss of livelihoods, actually, because most of this, you know, the people who are working from this population in the various countries, many of them, even if they had informal livelihoods and formal jobs, many of them have lost those under these movement controls. So to take Malaysia for an example, many of the refugees, not all of them work, but those who do work, who do it informally, many are in sectors like construction, for example. The Rohingya do a lot of construction service, you know, working at these, what we call the mamak shops, you know, these Malaysian tea shops, you know, quite low income. So a lot of those places have closed. You know, people who had those jobs, which were also extremely insecure without contracts, have basically lost those jobs. And at the same time, they're facing difficulty with food security. These are people who didn't have savings, who have difficulty paying rent anyway, who have difficulty, you know, supporting themselves with their daily necessities, even in normal times. So now with that loss, there's actually an enormous increase in food insecurity. Many refugee communities have literally been, you know, really without food supplies. And you also have the concern about being able to pay rent. So many of them also, you know, live either with their families or some of them also in larger groups if they're doing work on construction sites, for example. And because of that loss, there's a real insecurity and concern that there's going to be evictions actually coming up in the coming weeks or the coming month. And access to healthcare, I think this is something where it's a bit of a mixed picture in the region. You do have certain countries which have given really good access to healthcare for for migrants and for refugees and for anybody undocumented, basically almost the same actually as the local population. And that, you know, one of those good examples, we'll talk about those in a second, but one example is Malaysia. Quite quickly, the Malaysian government actually did make a statement and issued a circular to say that it wasn't specifically on refugees, but it basically issued a circular to say a directive that basically said all foreigners would be able to get testing for free and treatment for free if they had symptoms. So that covers everybody, including those who don't have proper documentation. But again, that had to be communicated over and over again to the population in their own languages. So that was a difficult thing to get that information out to these populations so that they didn't fear coming forward. The right to seek asylum, that's been compounded by restrictions, travel restrictions into the countries, as well as you know, countries, as well as the services that are provided by UNHCR, you know, looking at registration, looking at status determination. That's been a challenge also because a lot of the UNHCR services, I wouldn't say have totally shut down, but they've certainly slowed down. UNHCR is still very active, but they are focusing mainly on trying to support the governments with looking at the health issue, screenings where there might be a need to screen refugee and asylum seeker populations. So a lot of their other services like the registration, status determination, that's actually really slowed down. Even renewal of cards, that's slowed down. Movement restrictions affecting CSOs and NGOs. So that's a big issue as well because a lot of these governments don't officially recognize these populations. You really do have, you know, this gap between I mean, they're not covered really by the national assistance packages. So in the national response, it's a bit of a mixed picture where you could have a country which allows for testing, treatment, and doesn't discriminate on that basis. But then when it comes to things like providing food for a population that is, you know, in distress because of this movement control orders, then it's up to the NGOs. It's left, you know, basically to the non-governmental organizations to sort that out. And that's become a challenge because there's also really, you know, there's no proper databases because the populations are not documented. So, you know, different organizations are sort of, you know, scrambling to reach people and then have to keep cross-checking with each other and, you know, trying to set up coordination systems amongst themselves. So that's a challenge in many of these countries as well. Lack of access to information. That's something that we've also seen in many countries where if there are materials produced, they're not produced in the right languages or even the right form of communication. So to take an example, you know, there are Rohingya, for example, is not a written language. So it's actually something where you need to record voice messages. And the pace of translation of materials is just not keeping up with the pace of information that needs to be translated. So in that respect, you know, there are lots of positive efforts, but I still feel that there are groups who are being left out and don't have access to the right information. Physical security, of course, there has been an increase, but I think this also goes across, you know, basically all the national populations as well, increase in domestic violence cases under these restriction orders, but also specifically for refugees and migrants, looking at stigma. There's been an increase in xenophobia, definitely, this kind of anti-migrant, anti-refugee sentiment. Arrests as well. In some places there have been declarations of no arrest, but we still do see some arrests taking place, not necessarily for immigration violations, but for like a violation of the movement control order. And we do have some cases, that we've documented where people have been arrested and are being held, not sent to detention centers, but being held in police lockups for at least a few days. Whether or not that's because they are refugees is, I think, we need to look at that case by case. In some cases, yes, in some cases, no, but it's still a concern. And then lack of access to immigration centers. In some countries, there's been lack of access, for UNHCR for months already, but that lack of access continues. And the lobbies to try to get countries to release people in detention who don't need to be there, like if they're just there on a so-called immigration violation because they're a refugee, there have been lobbies to try to get people released. Thailand was considering, I'm not sure if they actually did agree already, but they were considering to at least release children, because they have made that, they've also made that commitment, to work on alternatives to detention for children. But in many other countries, that's still a conversation that is being had with not a lot of progress. Okay, next. So wanting to look at some positive practices in spite of all these challenges, I think that there are quite a few promising practices, we can say. Well, I mean, we still need to ensure that these continue through this period. But one good example, which we're very pleased about, is the free testing and treatment, which I mentioned before, for all foreigners, including undocumented ones in Malaysia. Policy of no arrests as well, based on legal status. So there have been a couple of announcements in Malaysia that have basically assured that nobody will be arrested. It doesn't mean that there's no discrimination and there's no harassment that's taking place. There definitely is. And we've also heard about refugees who, basically are still being bribed. They're still basically, being asked to bribe police, even at checkpoints. So that is still happening. Again, it's not necessarily a general thing, but there are incidents of it, which is not surprising. You also have, at least some access to national healthcare systems in some countries. So like in Indonesia, for example, it may not be exactly at the same type of service level as a local, but at least there's some system to ensure that there is access to national healthcare. I think the initiatives by non-governmental organizations and community-based organizations to get languages translated into the native languages that are spoken by these communities, it has been really important. But then again, as I mentioned, there are still challenges in terms of just keeping up basically with the amount of material that needs to be translated. And I would say that in particular, there's a bit of a lack of, there's lots of prevention material that's been going out, what you do to prevent COVID-19, what does social distancing mean, but there's been less on what does the law in your country mean when it comes to movement control. So a lot of people still don't understand that you're not supposed to play football, you're not supposed to sit outside, your flats, for example, during this period, and that's getting them into some trouble. Or how do you access food, for example? How do you access aid? Who do you go to? Who do you call? The other thing is looking at the mobilization of organizations for food distribution and other essential services for these populations has also been quite promising in some areas. There's a lot of that going on. And there's also been some initiatives where, refugees have been doing, have been creating livelihood projects where they've been doing things like making their own cloth masks, for example, to sell to, which have been bought up by NGOs who are delivering hygiene packs, for example. That's something that's happening in Ampang in Malaysia with the Afghan community. So that's something very positive. You also have good examples of refugees actually cooking meals for frontliners, and distributing, and that's given some positive stories also. But I think in spite of, there are lots of examples of good things that are happening, but we also have to be very cautious, I think, about, ensuring that there isn't going to be more marginalization structurally. And I think that, the reality is that inequalities have really risen to the forefront with this crisis and this and the response to it. And I think it's not just for refugees and asylum seekers and migrants, it's for everyone. So poverty, all of these forms of inequality are really affecting people's ability to be able to access proper services. And I think that we need to be able to really understand what those inequalities are. And we need to be prepared for quite a lot of economic insecurity in the future. So I think that, looking at this not only as obviously a health crisis, but one that's really going to have a longer term effect is also really important. Okay, I'll end there and look forward to the discussion.